Welcome. Have you ever heard of a condition that can affect not just your eyes, but also your brain nerves and blood vessels? Today, we're diving deep into a rare but serious disorder, cavernous sinus thrombosis, or CST. Join us as we explore its causes, symptoms, diagnosis, and treatment, shedding light on this complex medical challenge. So, what exactly causes this condition? Cavernous sinus thrombosis usually stems from an infection that spreads from nearby sites. The most common culprits are infections of the sinuses, like sinusitis, especially sphenoid sinusitis. Other potential sources include infections of the face, teeth, or even the orbit, the bony socket housing your eye. Bacteria, particularly Staphylococcus aureus, are the most frequent offenders, but fungi and other pathogens can also be responsible in some cases. Rarely, CST can occur without an identifiable infection, sometimes linked to blood clotting disorders, pregnancy, or certain medications. To understand CST, it's crucial to visualize the cavernous sinus. Imagine it as a sponge, like space located at the base of the brain behind the eyes. This sinus houses crucial structures, the internal carotid artery, which supplies blood to the brain, and several cranial nerves responsible for eye movement, sensation in the face, and even pupillary function. When an infection or other trigger causes a blood clot, a thrombus, to form within the cavernous sinus, it obstructs blood flow. This blockage increases pressure within the sinus, compressing the cranial nerves and potentially affecting the carotid artery. This compression leads to a cascade of symptoms, ranging from eye pain and vision problems to neurological deficits. Cavernous sinus thrombosis is considered a rare condition. While precise global statistics are difficult to obtain, it is estimated to affect a very small number of individuals annually. It's more commonly seen in regions where access to prompt medical care and effective antibiotic treatment may be limited. Although it can occur at any age, it's relatively more frequent in young adults and individuals with underlying medical conditions that weaken the immune system or increase the risk of blood clots. The signs and symptoms of CST can be quite dramatic and often progress rapidly. Eye-related symptoms are usually the first to appear. These include severe headache, often localized behind the eye or in the forehead, proptosis, or bulging of the eyeball, chemosis, which is swelling of the conjunctiva, the clear membrane covering the white part of the eye, and ophthalmoplegia, paralysis of the eye muscles, leading to double vision or difficulty moving the eyes. As the condition progresses, neurological symptoms may develop, such as decreased level of consciousness, seizures, and focal neurological deficits like weakness or numbness on one side of the body. Fever and general malaise are also common. Diagnosing cavernous sinus thrombosis requires a high degree of clinical suspicion and advanced imaging techniques. A thorough neurological and ophthalmological examination is crucial. Magnetic resonance imaging, or MRI, with contrast is the gold standard for visualizing the cavernous sinus and detecting the presence of a thrombus. Computed tomography, or CT, scanning can also be helpful, particularly in ruling out other conditions like sinusitis or abscesses. Blood tests, including a complete blood count, coagulation studies, and blood cultures, are essential to identify the underlying cause of the thrombosis, especially if an infection is suspected. While CST doesn't have distinct classifications or types in the traditional sense, its presentation and severity can vary widely depending on the underlying cause, the extent of the thrombus, and the promptness of treatment. Cases can range from relatively mild, with primarily ocular symptoms, to severe, life-threatening conditions with significant neurological involvement. The primary goal of treatment for cavernous sinus thrombosis is to address the underlying cause, prevent further clot formation, and manage complications. Intravenous antibiotics are crucial in cases caused by infection. Broad-spectrum antibiotics are typically initiated immediately, followed by adjustments based on culture results. Anticoagulation with medications like heparin or low molecular weight heparin is usually administered to prevent the thrombus from propagating and to facilitate its resolution. Corticosteroids may be used to reduce inflammation and swelling. In some cases, surgical drainage of the sinuses or abscesses may be necessary. Supportive care, including pain management, seizure control, and monitoring of neurological function, is also essential. Preventing cavernous sinus thrombosis hinges on promptly treating infections of the sinuses, face, and teeth, maintaining good hygiene, seeking early medical attention for any signs of infection, and completing prescribed antibiotic courses are crucial. For individuals at increased risk of blood clots, such as those with underlying blood clotting disorders, prophylactic anticoagulation may be considered under the guidance of a physician. The prognosis for cavernous sinus thrombosis varies significantly depending on the promptness of diagnosis, the severity of the condition, and the underlying cause. With early diagnosis and aggressive treatment, the prognosis can be relatively good, with many patients making a full recovery. However, delays in diagnosis or treatment can lead to serious complications, including permanent vision loss, neurological deficits, stroke, and even death. Ongoing research focuses on improving diagnostic techniques, developing more effective treatments, and identifying risk factors for this rare but potentially devastating condition. Some studies are exploring the use of newer anticoagulants and thrombolytic agents to improve outcomes. Continuous monitoring of patients and long-term follow-up are essential to manage any residual complications and prevent recurrence.